Hello, my name is Dr. Kristina Go, and I'm a colorectal surgeon at Upstate University Medical Center. Before we head over to Katie for some recipes that promote a healthy colon, I'd like to talk to you briefly about colorectal cancer. Excluding skin cancers, colorectal cancer is the third most commonly diagnosed cancer in the United States in both men and women. And colorectal cancer is associated with several risk factors. Now, there are some risk factors, like smoking or eating the right foods, that can be changed, whereas there are other risk factors, like a person's age or family history, that can't. But having a risk factor, or even many, doesn't mean that you'll necessarily get the disease. And on the other hand, there are some people who get the disease that don't have any known risk factors. Researchers have found several risk factors that might increase a person's chance of developing colon cancer or colon polyps. Let's review them. Let's start with risk factors that you can't change. Age. Your risk of getting colorectal cancer goes up as you age. Younger adults can get it, but it's much more common after the age 50. Racial and ethnic background. African Americans have the highest colorectal cancer incidence and mortality rates of all racial groups in the United States. Jewish people of Eastern European descent, or Ashkenazi Jews, have one of the highest colorectal cancer risks of any ethnic group in the world. The reasons for this aren't fully understood. Family history of colorectal cancer, or adenomatous polyps. Most colorectal cancers are found in people without a family history of colorectal cancer. Still, nearly 1 in 3 people who develop colorectal cancer have other family members who have had it. People with a history of colorectal cancer in a first-degree relative, that means parent, brother or sister, or child, are at an increased risk. The risk is even higher if that relative was diagnosed with cancer when they were younger than 45, or if more than one first-degree relative is affected. The reasons for the increased risk are not clear in all cases. Cancers can run in the family because of inherited genes, shared environmental factors, or some combination of the two. If you have a family history of adenomatous polyps or colorectal cancer, talk with your doctor about the possible need to start screening before age 45. Now let's talk about risk factors that you can change. Many lifestyle factors have been linked to colorectal cancer. In fact, the links between diet, weight, and exercise and colorectal cancer risk are among the strongest when compared to any other type of cancer. Being overweight. If you are overweight or obese, as in very overweight, your risk of developing and dying from colorectal cancer is higher. Being overweight, especially having a larger waistline, raises the risk of colon and rectal cancer in both men and women, but the link seems to be stronger in men. Physical inactivity. If you're not physically active, you have a greater chance of developing colon cancer. Being more active can help lower your risk. Smoking. People who have smoked tobacco for a long time are more likely than non-smokers to develop and die from colorectal cancer. Smoking is a well-known cause of lung cancer, but it's linked to a lot of other cancers too. Heavy alcohol use. Colorectal cancer has been linked to moderate to heavy alcohol use. Limiting the use of alcohol or stopping alcohol altogether could have many health benefits, including lowering the risk of many types of cancers. Now I'd like to introduce Katie Krafczek, our Upstate Cancer Center nutritionist. She's going to show you 2 recipes that include ingredients for a healthy colon.
Hi everyone, I'm Katie Krawczyk, Upstate Cancer Center's Registered Dietitian. Research shows that what we eat plays a crucial role in risk of colon cancer. A diet high in fiber and adequate in a B vitamin, known as folic acid or folate, helps reduce our risk. Fiber helps process food through our digestive system and onto elimination, so it reduces the time that potential carcinogens sit in the intestines. It also has anti-inflammatory properties. We need at least 25 to 30 grams of fiber a day, so even an extra 5 grams in a bowl of oatmeal can greatly reduce colon cancer risk. Both fiber and folate are found in fruits, vegetables, and grains, especially our dark green leafy vegetables, legumes, and whole grains. So this first recipe I'm sharing today is a carrot and quinoa breakfast bowl. So while you can use oats like a traditional oatmeal, I'm using quinoa for just a little extra variety and texture. It's a whole grain and it has a nutty flavor, contains all 7 essential proteins, and it's a great source of fiber. So to prepare this kind of breakfast dish, you're going to need the quinoa, almond milk or whatever milk that you prefer, almond butter, walnuts, vanilla extract, pure maple syrup, it's up to you if you want a little bit of sweetness, cinnamon, walnuts, shredded carrots, coconut. I think that's everything. So you want to use a larger saucepan for this recipe. I've already started. I've put in my quinoa in almond milk, brought it to a low boil, and then I've turned down the heat, and I'm going to add in my carrots now. A little bit of maple syrup, the cinnamon, and vanilla. Turn down the heat to low. Give it a little stir. And then again, just like the package instructs you for the quinoa, put the lid on it and then let it simmer there for about 12 minutes. Quinoa cooks best if you don't peek at it, so keep that lid on there. So once the time is up, we're gonna remove it from the pan, then we're gonna fluff the quinoa, and then we're gonna let it sit for 15 minutes, and then you can add in your almond butter, walnuts, if you wanna add in coconut or any more shredded carrots. So here's our finished product. You can see the quinoa is nice and fluffy. I've put in the almond butter, topped it with some walnuts, extra carrots, and some shredded coconut. And then we have a warm breakfast that's high in protein, fiber, and folate. To reduce risk of colon cancer, we also want to avoid processed meats. These include lunch meats, sausage, hot dogs, bacon, ham, pepperoni, and corned beef. Studies have shown that even small amounts may increase colorectal cancer risk. Compared to eating no processed meat, eating 3.5 ounces every day, such as a large hot dog, increases risk by 3%. Processed meats are often smoked, and the high heat produces carcinogenic substances and damages to our DNA. Nitrates are added to processed meats to preserve them, and these are also cancer-causing compounds. Heme iron found in red meat may damage the lining of colon. So to decrease your overall risk, you can make some simple substitutions, like replacing deli meat with chicken or fish, using beans and lentils instead of sausage and chili and pasta, trying different proteins like cottage cheese, eggs, nuts, hummus, and using herbs like garlic, fennel seed, and chili flakes to add flavor to your dish. The second recipe I'm sharing is an easy sweet potato black bean chili. So you'll need just a few ingredients. Got vegetable broth, salsa, olive oil, black beans, your sweet potatoes, and then spices. I'm using our cumin, cinnamon, chili powder, and some hot sauce. I've also added an onion, so we've got the onion going. It's translucent, soft, ready to go. Just gonna give it a stir. And then I'm going to add my spices and sweet potatoes. And then I'm gonna let those cook for about 3 to 5 minutes. And then I'm gonna add the rest of my ingredients. So I'm going to add in my broth, salsa, and black beans now. Stir. Gonna make sure we're on medium heat. And I'm going to allow this to simmer for 30 minutes and stirring about every 10 minutes. I'm going to keep the lid on it. Now, this chili will be delicious if you eat it right away with your favorite toppings, either cilantro, cheese, onion, or guacamole. But the flavors will be even better if you prepare this the night before or allow it to sit for a few hours. But thank you so much for joining me in the kitchen for dietary tips to reduce your risk of colorectal cancer. Please remember to fill out the survey at the end of this so we can send you these recipes, and I'll leave you with some last few words from Dr. Go.
Now I'd like to discuss colorectal cancer screening with you. Patients with an average risk of colorectal cancer should start regular screening at the age of 45. People who are in good health with a life expectancy of more than 10 years should continue that screening through the age of 75. After 75 years old, they should discuss with their doctors whether or not they should continue screening. So, what's considered average risk? A person is at average risk if they don't have a personal history of colorectal cancer or certain types of polyps, a family history of colorectal cancer, a personal history of inflammatory bowel disease, that's either ulcerative colitis or Crohn's disease, a confirmed or suspected hereditary colorectal cancer syndrome, such as FAP, familial adenomatous polyposis, or Lynch syndrome, also known as hereditary non-polyposis colon cancer, or HNPCC. A personal history of getting radiation to the abdomen, as in the belly, or pelvic area to treat a previous cancer. So if you don't have any of these risk factors, talk to your doctor about whether or not you should get screened before age 45. There are several options for colorectal cancer screening. The first is a stool-based test. A stool-based test can be done in the privacy of your own home by placing a small sample of your stool on a lab kit and mailing it in for review. This type of test needs to be done every year for screening. Moreover, if the test comes back abnormal, you will need to get a colonoscopy. The second type of test is a colonoscopy. A colonoscopy is a same-day procedure done at a medical center where the doctor uses a camera to look in the inside of your colon. It requires anesthesia during the procedure. Also, to prepare for the procedure, you have to drink a bowel prep the day before your colonoscopy in order to clean your colon out. A colonoscopy can find polyps, growths that can turn into cancer, and remove them before they turn into cancer. If a polyp is found, you may need to have a repeat colonoscopy earlier than 10 years. But if your colonoscopy is normal, you may only need to do another colonoscopy 10 years later. Whether you decide on a stool-based test or a colonoscopy, the most important thing is to get screened. Talk to your healthcare provider about which tests might be good options for you, and to your insurance provider about your coverage. If you're interested in having a stool kit mailed to you, please fill out the Survey Monkey attached to this video. Include your address and insurance provider, and we'll mail a kit to you. Thank you for joining us and learning more about colorectal cancer, recipes promoting colon health, and about colorectal cancer screening. We hope to hear from you soon.